Doctors of Reddit, what are the dead giveaway signs that someone is faking? I'm a nurse on a floor that deals with a lot of chronic and acute pain patients. Most recent instance was this lady from a few weeks ago that was apparently splitting the oxycodone we were giving her in half in her mouth, and then when the nurses' backs were turned, she would stuff it in a pill jar. A night nurse caught her in the act and all of her shit had to be searched. We found 20 half tablets of oxycodone she had been stashing. She told us that she was saving them for her family in case they need them because it's just so hard to get an oxycodone prescription these days. I had her a few days after that, and she was having some abdominal pain, stat x-ray showed only gas. She just really needed to fart. But she was screaming, claiming it was a 10, and making a huge fucking scene. She demanded Dilaudid through her 4, and she wanted it to be pushed fast. Huge red flag right there. She wanted the high, not the relief. Doc straight up said he wouldn't give her Dilaudid because she was already on so many opiates. She then demanded lorazepam, still through her 4 of course. Doc was like fine whatever, just one time and only a low-end dose. I was flushing her 4 with normal saline first, to make sure her 4 was patent, and she leans back and is like, oh that's so much better already. Hadn't even given her the lorazepam yet, SMDH. For real though, gas pain is no joke. I was once rushed to the hospital, car, as I knew I couldn't afford an ambulance, because I was doubled over in pain crying. I thought that something had ruptured or exploded. They weren't busy at all this night and got me back within 15 minutes of showing up. I don't like pills. Never have, because I know I had an addictive nature when it comes to substances, so I just avoid them altogether. So they do their test and scans and the doc comes in and tells me it's just severe gas buildup. I'm in tears still and ask the doc how the hell can gas cause this much pain and that it's gotta be something else. Doc says let me give you something and if that doesn't work we can try something else. I'm like okay cool, because no way gas hurts this much. 30 minutes later I'm in the bathroom like I just spent an hour at Taco Bell. The doc comes in to check on me when I finally manage a free moment. I can't help but look dumbfounded. Since they weren't busy at all, he sat down and explained that since I have IBS I need to be more careful with my intake or else this could happen again. All the while I felt like a complete dumbass because gas had me in tears. I thanked the doc. He gave me some gas relief pills and suggested some diarrhea meds in case it happens again. I've never in my life been so sure it wasn't something only to be proven wrong. Can confirm, as someone who has to self-catheterize on the regular, I've gotten used to the feeling of discomfort and burning, but my god, when it first was a thing it was hell. I had to have anesthetic gel just to do it. Note, self-catheterizing is due to impaired bladder function as a result of stage 4 endometriosis. Gotta love my body. Edit, thank you for all the comments. Honestly, self-catheterizing isn't the worst thing in the world, I'm just pretty much used to it. I'm currently going through a lot of pain management, so that's helping me function relatively normally, whatever normal is anyway. And I'll be getting my endometriosis excised hopefully at the end of the year / start of next year. I think I'd like to use this as a reminder to all the AFAB people reading this: if something doesn't seem right with your periods, please get it checked out. Endo is a nightmare to diagnose, but if you can find out that you have it earlier, you may be able to get help as soon as possible. My ICU attending has a great story about caring for a stroke patient during his fellowship. The stroke patient was a frequent flyer, and despite everyone knowing that she was faking her paralysis, she still received care. Until one day when he was really fatigued, he was told by a nurse that the patient was being rude and refusing therapy. So he walked into the patient room and said, "Ms. Blank, this is absurd. I know you're faking your paralysis. Everyone knows you're faking. We are all sick of this." And left. The patient walked out. AMA. Edit, to clarify, AMA is against medical advice. And to address the people who ask if her leaving is even considered against medical advice if she wasn't paralyzed, the answer is yes. She was admitted to the hospital under the care of physicians and left without being properly discharged, which strictly speaking is AMA. Also, this isn't my story. My attending physician, the doctor who is training me, told me about this patient that he treated 20 years ago, so I don't know more details. My husband had a severe back injury due to falling at work. He blew out his L5S1, and LNI put him off due to faking injury and wouldn't allow him pain meds beyond steroids or ibuprofen. When they finally got him in for an MRI, the doctor was horrified because A, my husband couldn't walk standing straight up or longer than 10 minutes, B, the way his discs blew out had blocked his sciatic nerve about 95%, and C, they tried to do nerve blocks and 2 hours later when the local wore off he was in worse pain. The surgeon was horrified with what he found when they went in for surgery, different surgeon than drive, and loaded us up with pain meds for when we got home. He's gone in for issues a couple times since then, and they look at him like he's there for drugs. It really irritates me because I have an ex who literally fakes the same injury, walks into a drive office and complains of pain just for pain meds, and gets loaded with opiates, but my husband who literally couldn't walk must have been faking it. My wife is a doctor and she had dealt with people faking things like one of their legs simply not working. The trick is to tell them to do some other thing with a positive phrasing, making it seem like doing so will prove the patient's story is true, while it proves the opposite. This works for both people who are actively faking it and people who have subconsciously convinced themselves the problem is real. For example, if they say their right leg can't move, you first ask them to try lifting it, which they try and obviously fail to move or flex any muscles in it. Then you act intrigued and say something like, "Now your left leg is the one that works fine, right? Go ahead and lift it up for me for comparison." While they are doing this, you still casually have your hand on their right leg, which you had placed there when you were feeling for any activity when they tried to lift it. Now when the person is laying there and lifts their left leg to prove their right one doesn't work, they will naturally flex their right leg to provide balance with their left leg in the air. If they are able to flex their right leg then but won't even flex it when they claim to be trying to move it, then you know their leg still works. You just have to narrow down if they realize are faking it intentionally. A nurse thought I was faking that I could not swallow when I woke up from jaw surgery. When I came out of the surgery and was panicking telling them I couldn't swallow my own saliva, the nurse just told me, "Yes, you can. This surgery wouldn't have anything to do with your ability to swallow." I could also barely speak and started crying and pleading with her to believe me. I ended up having cranial nerve damage that paralyzed half of my tongue, trachea, esophagus, and vocal cords. It took 8 months to heal. I drank thickened water, which is as gross as it sounds, for 8 months. Having a healthcare professional not believe you during trauma is absolutely scarring. Edit, clarified that the nurse was the only one not believing me. My surgeon absolutely did. It was scary though because he actually looked frightened when he finally came in to examine me, like he had never seen this before. Second edit, answering some questions. Surgeon did believe me, and the conclusion they ended up coming up for the cause was that my nerves must have shut off protectively due to the pressure of the laryngoscope during intubation. We did see a lawyer, but they said it's very hard to pursue legal action in malpractice cases because it's very hard to prove, but regardless, if I recovered, which I did, there is no case. Yes, I realize this doesn't answer the ops question, just saying that maybe health professionals should be careful when trying to discern if someone is faking it. If they're not, it can be extremely traumatic. Surgery was for an ossifying fibroma, a benign bone tumor, in my lower jaw. Had 4 teeth removed and a portion of my jawbone. Thickened water is water with a thickening agent added, usually xanthan gum. When you have damage to those throat muscles, thin liquids are actually the hardest to swallow. I think mostly. Not a doctor, but doctors often think my family is faking. For an unknown reason, when there's something wrong with our organs, our white blood cell count doesn't go up. My younger sister got appendicitis when she was in her early teens. Crying from the pain, but blood work showed nothing was amiss. If it hadn't been for other tests and my dad's insistence on them, she might not have been treated in time. So they open her up and surprise. A gross appendix that was close to bursting. My dad insisted because of an operation he had just had to remove his gallbladder. He was in so much pain that he was vomiting, could hardly walk. It had been building up for a while and he was pretty sure what it was. He went to the doctor, but blood work showed his white count was normal. My dad had to scream in agony on their table for ages before they finally gave in and took him to surgery. They go in, see a perfectly healthy looking gallbladder. They pull it out, cut it open, and sand spills out. Dry sand. We learned later that it had completely stopped working and totally filled with protein chains. It was removed before it started killing my dad in earnest. So yes, people fake it, people lie, but do double check just in case. Edit, holy cow, okay, this is now my most upvoted comment. And my first awards. Thank you. These stories took place over a decade ago, so my details were sparse and sometimes incorrect. So, after double checking with Dad, the stuff only looked like grains of sand. They were deformed trypsin protein chains. We learned this when Dad was diagnosed with a rare genetic disorder called alpha-1 antitrypsin FM phenotype. It's not fun. His lungs and liver deteriorate over time because of incorrectly shaped proteins getting stuck in his liver cells and not making it to the lungs, to put it simply. And yes, my dad is being studied. Every time he gets a biopsy, doctors gather data because his phenotype is so rare. And I got a couple of details incorrect. It had been a while since the story was told to me. The gallbladder didn't actually look healthy. That was a tidbit from a different story. My father has had basically every organ removed that he can and still be alive. Turns out that my dad found out about the white count thing during his own appendectomy. So, later, when he was in pain again from his gallbladder this time, he made sure he went to the same doctor he had gone through that whole kerfuffle with, and, by that point, my dad's severe pain was enough reason to operate and take a look. They found the most diseased-looking gallbladder they had ever seen, full of sand. They estimated it hadn't functioned for years. As for the white cell thing, there is a name for it that we've since found out that I didn't know about. But no one can remember it at the moment, sorry. And weirdly, can't find it on Google. Then, this is all exacerbated by biliary dyskonesia. Very small ductwork that is easily clogged. More pain. And to top it all off, Dad was exposed to high levels of radiation as a child. This on top of winning that dumb genetic lottery that no one wants to win. Thanks again for all your amazing comments and questions. But an exploded inbox is what I get for not getting on Reddit all day. I'll try and answer some. One day about 3 years ago I went to the ER with extreme mid-right back pain and shortness of breath. The first doc was cool, took it seriously enough. The next doc takes over. She tells me I'm having a marijuana overdose and to go home. My heart rate before she walked in was 165. My O2 sat was 92. I go home. The next night I can't breathe at all. I had to crawl down the stairs to get my husband. We get to the hospital again and I remember nothing. My husband told me that same doctor was there when I came in. That morning I was apparently really out of it. With my heart rate well above 150 and my O2 now 90. Another doctor comes on and asks my husband why he didn't get me to stay the night before. He explained what happened to the doctor. At that point the doctor apparently blurts out in an angry tone, "Well, your wife is dying, she has double pneumonia and is in DKA, she needs an ICU bed." Even hour later I went into respiratory failure. They had to intubate me. I was in a coma for a week plus 10 days of recovery after I woke up. Marijuana's a dangerous drug, kids. Remember, if they find it in your urine they won't take your other symptoms seriously. Not a doctor but a therapist. For some reason adolescents like faking DID, formerly multiple personality disorder. It's a pretty rare and debated diagnosis in our field. I've seen people fake it by mimicking how it's portrayed in movies and on TV. Red flags are them telling you, I have multiple personality disorder and, of course, not meeting the actual diagnostic criteria. Some people feel like the common diagnoses aren't big or special enough to accurately represent their struggles, so they cosplay something worse. Whatever you're working through is a big deal to us. If you feel like you have to fake or exaggerate your symptoms for your therapist, consider finding a different therapist. Editing to clarify my last sentence since I'm getting some aggressive replies. If you don't feel like you can be authentic with your therapist, continue searching until you find a therapist you feel comfortable with. Sometimes it's just not a good fit. It happens. You're not obligated to continue seeing a therapist you don't feel comfortable with. If you feel like you need to fake or exaggerate something to be taken seriously by a therapist, it's not a good fit. Continue searching until you find someone who takes you seriously. Also, I'm not a solid resource for DID information. It's not a common diagnosis and my experience with it has been extremely limited. Stick to peer-reviewed information and experts in the field for the most accurate and up-to-date information. I hate this. I went to an specialist once about some issues with my ears that were affecting my hearing and equilibrium, was having intense bouts of vertigo, with a constant sliggletie off balance. Instead of focusing on what I was saying was bothering me, he asked me to speak plainly. I guess I was using slightly more technical terms. I couldn't speak plainly because I was busy translating my every word, since it had been a while since I last spoke the language. I live abroad most of the time and it takes a bit of time for me to switch from English/German to Romanian, plus I had just come back a couple of days before. That made the doctor decide that I was a hypochondriac with nothing better to do than to Google shit. In the end, turns out my vertigo was caused by an issue with my spine, but the ear was plugged up, hence the hearing issues. I had to visit his office three times before he deemed it necessary to use the scope thingy to look into my ear and actually resolve my issue. I felt like I was going crazy for over a week because I kept on hearing everything echoed in my right ear. Also, turns out I have really narrow and weirdly angled ear canals, and therefore shouldn't use drops most of the time, which he obviously prescribed and made the issue worse. The silver lining is that because of this experience I learned to push if I was having a medical issue that my doctor would rather ignore. That was how I got my doctor to take my back pain seriously, double-sided hernia somehow, and to diagnose, and start treatment of, my autoimmune issue. Turns out feeling constantly run down at 23 is not normal, who knew? Not a doc, but figured this is a good place for the time I was accused of faking a broken arm. I was somewhere between 4 to 7, it's a blur so I don't exactly remember when. I had fallen off of a bed and into a nightstand at just the right angle to really mess my arm up. I was screaming and cried out every time I tried to put pressure on it, lift it, etc. My parents take me to a hospital and get me x-rayed, and the doc asks me how much it hurts. Well, of course, the rest of the night I was subjected to the most intense pain child me had ever had, and currently, I wasn't putting pressure on it, so at that exact moment on a pain scale, I had rated it a 2. The actual injury was a 10 and testing it was definitely high on the scale. Because of my low pain rating, the doctor told my parents I was faking and then proceeded to bill us an obscene amount. We get a call 3 days later, mind you, I was sent home, no painkillers, cast, nothing, saying that someone happened to peek at my x-ray and noticed that I had a pretty large fracture on my elbow. Said I had to come in and get a cast and more x-rays. I'm still pissed at that doctor to this day because he made me feel like a liar to my parents, made me feel like I was being a crybaby, and then made me have an untreated fracture in my arm for 3 days. Dr. Doctors of Reddit, why did a doctor think I was faking having a broken arm, even with an x-ray proving I had one? Not a doctor, but I once had a nurse tell me something that stuck with me ever since. I had a gallbladder attack when I was younger, and let me tell you, that's some of the worst pain I've ever felt. I was doubled over, vomiting bile, and unable to move. My mom took me to the ER at 1 a.m. in the middle of a snowstorm. As the nurse was doing my initial evaluation, she asked me the standard on a scale of 1-10 pain question. I thought for a couple seconds, and told her 7 or 8. It hurts really, really bad. She nodded knowingly, and told me got it, it hurts really bad. Most people who tell me 10 are lying. No one ever feels a 10. In hindsight, I'm not sure that's the best practice for a nurse. Still, after seeing drug-seeking patients myself, I understand her frustration. They ended up giving me morphine, which brought that number down quite a bit. Edit, I want to clarify my, or rather the nurse's, comment. People can definitely feel a 10 on the pain scale, and I don't want to invalidate your experience if you felt that. I think the point is that if you do feel a 10, the medical providers will probably know without having to ask. Conversely, if an otherwise lucid and calm patient replies with 10, they might not be telling the truth. Not a doc or nurse, but as a patient it's really messed up when they think you are faking. I had an extremely bad year last year and was almost daily losing consciousness. Couldn't keep food or some days water down. I collapsed one day after having horrible stomach pains. The ER doc doing his job very quickly assessed me and had them give me Dilaudid, thinking I was probably going to be rushed into surgery for gallbladder removal. At the time this was understandable. However, this particular medicine made me become completely unconscious. They were then not able to do my intake or ask me additional questions. The next doctor assumed that I was on drugs because I shouldn't have had that reaction. He ran all sorts of drug panels on me and they of course all came back negative. They then had to give me Narcan twice to bring me back as I was out for much longer than I should have been. I'm much better now, but that was an absolute horrible experience. I don't remember all of it, but I do remember my sister who was there with me was in tears from how I was treated. She is a medical professional herself and could not believe what was happening in her own hospital. The doctor who thought I was on drugs no longer works there. My mom was sick for over 2 years, like every month she'd have debilitating pain in her stomach that would impact her ability to do anything that wasn't laying in bed hurting. She went to the doctor a few times for it and was dismissed, no tests were ran. They just said sounds like IBS/indigestion/food allergies. She seemed at a loss of what to do because when she was in pain she was always so exhausted and the doctors weren't doing anything, so she just gave up asking for help. In March I finally said fuck this and I started calling the doctors for her every other day. Took her into the hospital and they discovered diverticulitis, gave her antibiotics and sent her home. Another 2 weeks goes by and I'm like, this isn't getting better, took her back, more antibiotics. Except not even a day went by before the surgeon called and said bring her back, and they opened her up for emergency surgery. Turns out her intestines were infected and starting to rot, and the infection had spread to her uterus and right fallopian tube. So the thing I learned from this is if you want treatment you have to be so goddamn persistent that eventually someone might actually help you. I hate this. I went to an specialist once about some issues with my ears that were affecting my hearing and equilibrium, was having intense bouts of vertigo, with a constant sliggletie off balance. Instead of focusing on what I was saying was bothering me, he asked me to speak plainly. I guess I was using slightly more technical terms. I couldn't speak plainly because I was busy translating my every word, since it had been a while since I last spoke the language. I live abroad most of the time and it takes a bit of time for me to switch from English/German to Romanian, plus I had just come back a couple of days before. That made the doctor decide that I was a hypochondriac with nothing better to do than to Google shit. In the end, turns out my vertigo was caused by an issue with my spine, but the ear was plugged up, hence the hearing issues. I had to visit his office three times before he deemed it necessary to use the scope thingy to look into my ear and actually resolve my issue. I felt like I was going crazy for over a week because I kept on hearing everything echoed in my right ear. Also, turns out I have really narrow and weirdly angled ear canals, and therefore shouldn't use drops most of the time, which he obviously prescribed and made the issue worse. The silver lining is that because of this experience I learned to push if I was having a medical issue that my doctor would rather ignore. That was how I got my doctor to take my back pain seriously, double-sided hernia somehow, and to diagnose, and start treatment of, my autoimmune issue. Turns out feeling constantly run down at 23 is not normal, who knew?